So our next two speakers are going to talk about LA County Fire Department response to 9/11, and their talk is an example of various multimedia methods used in the classroom. I think it was Dr. Palmer's classroom.
Same class.
Same class, okay. All right. So the first speaker is Kimberly Morales-Johnson, and Kimberly graduated from University of Laverne in 2006. She is an active member and tribal secretary of Gabrielino Tongva, San Gabriel Band of Mission Indians. A former elementary teacher, she helped develop the culturally sensitive history curriculum for the state of California. She has also served on numerous boards throughout Los Angeles County, including the Los Angeles County Native American Indian Commission, and she is currently pursuing her Master's of Public Health at the School of Community and Global Health to further health care within the Native American community. Our second speaker is Yvonne Maldonado, and Yvonne began her tenure in the labor movement about 10 years ago at 22. At age 22, she was promoted to Director of Membership Services for one of the largest labor unions in North America, serving over 190,000 long-term care members. Yvonne eventually became the Director of Operations for San Bernardino and Imperial counties, and during that time she was enrolled at Pitzer, where she earned her BA in Organizational Studies. Yvonne has taken on new tasks for a different labor union as their chief negotiator, and she travels throughout California securing contracts for thousands of long-term care workers. In 2005, Yvonne was honored by the U.S. Congress, the U.S. Congress, California State Assembly, California State Senate with the Woman Making History Award for her dedication and contribution to the labor movement and the communities of San Bernardino and Riverside counties. And today she's enrolled in our Masters of Public Health program at the School of Community and Global Health. So welcome, Yvonne and Kimberly.
Good almost afternoon. Oh, it is afternoon. Okay. This particular assignment was very interesting to me as a former teacher, because we were told at our whole time during education that if you teach something and you tell the kids, they might learn it, but if you show them, they'll remember. If you show them video, you've implanted something in their head. And so this was something that when we decided what we were working on, that we wanted to integrate video and give everybody an awareness of something that's not looked at a public health level.
So the purpose of our specific assignment in our course included the ability to identify and understand a particular disaster and how teams work within that disaster, and how that's also correlated with the disaster cycle. The students were set up in groups and to pick this particular disaster that they would be working on, and also had an opportunity to do interviews and work directly with agencies that were involved in that area that they were looking at. Our particular group decided to look at September 11th, 2001. We all clearly know it was a horrendous time for us here in America, but it was an important area where we saw some relief and recovery efforts that we wanted to focus on, and actually how that sort of shifted to look at mental health.
I was home in bed, sleeping, turned on the TV, sure enough, saw that whole aftermath of the first tower after it was struck. I remember that first one coming down, and it was like being gutted. It started out at about 8 or 9 guys, and it dropped down to about 5. Understandably so, because when I mentioned it to my family that what I was going to do, not what I was asking them to do, what I was going to do, it didn't go well with anybody. My wife, my kids, the in-laws, my mom and dad, nobody liked the idea. They were all very opposed to it. But as you know, it's something that you need to do.
Go ahead. This was one of the interviewees that we had an opportunity to meet, a Los Angeles County firefighter who actually volunteered and took time off and went to New York to assist the fellow brothers and sisters, firefighters that needed assistance at the Ground Zero. And of course, just for the background, I mean, we all know, again, how terrible this event was. Over 2,900 victims and 19 hijackers perished that day. An additional 411 emergency responders died.
So we wanted to go out and to get some real life experience and to bring this to a personal level of what actually happened. So we went out and we interviewed Larry Collins, who is a battalion chief for Los Angeles County. I think it's also notable that Larry was part of the USAR and the FEMA when it started to come together and the development of that program. So he's seen a lot of just different development methods, which actually really contributed to the interview and his part during September 11th. We also interviewed Ted Garcia, which was the last person that you saw. He voluntarily went to New York. He was going to pack his car and drive immediately after he heard about the event, but they ended up getting to go on a military aircraft to New York and stayed for a long time. Then we interviewed Herbert Johnson, who went back just for funerals, and Ted came back with stories of people going to firemen's funeral, and there were only maybe 4 to 5 people at the actual funerals. So as this brotherhood and this mental health, I think this the way that they were trying to deal with the helpless feeling that we all felt, they decided just to go to funerals. The last person that we interviewed was Dr. Rudy Neidiger, and he is a psychologist, a crisis intervention psychologist in New York, who actually was part of one of the mobile units that went down to debrief with some of the firemen and policemen after September 11th.
I think when disaster strikes, it's pretty evident that it is important that we address all aspects of health, including mental health. In this case, our project developed, we saw a growth with the firefighters of this mental health support that they felt was truly needed in order to cope with this disaster.
There was a lot of FDNY guys that we had a lot of close contact with, and they wanted to tell you about their guys. They wanted to tell you about, Joe and Bill, who they were, and they wanted to cry with you. They wanted to share that with you, and big strong guy working on the pile, and they get back and then they just bawling their eyes out, just talking about it, and so a lot of that was sitting and just talking and sharing, and then we recognized about the 4th or 5th day out there, they were having funerals and nobody was going because everybody was working on the pile. So they didn't have any fire department representatives there, and so we decided, let's take. We worked on the pile. As soon as we get off, let's go hit a funeral. So, let's go make sure we go there. It's only 5 of us, but let's go and make a showing. And again, you don't realize how simple of an idea that was, but what a dramatic effect. And the people that were there, the families, how much they appreciated it.
Well, at the end, I think, as I said, while our intentions were to look at relief and recovery efforts, it was pretty evident that mental health was definitely an important aspect that helped these rescuers kind of go through the process while they were helping everybody during this terrible event. We had our opportunity to interview LA County Firefighters was definitely one that we were very grateful for. And just seeing them, as Ted mentions here, a simple concept of just going to a funeral because they couldn't go because all the locals that were not injured were working on the pile. So just seeing that shift to across the nation and across in our group, seeing how it kind of came to California, right? How it really affected the firefighters out here, and to the point where they created a nonprofit, LA County Firefighters, honoring FDNY, and bringing the families of fallen rescuers here to have a week-long vacation. And again, it just ended up, at the end, it ended up looking more as a multi-level mental health issue. The professionals with Dr. Rudy Neidiger and the DRN doing crisis-free counseling that was not only short-term, but in many cases long-term, seeing the firefighters and their families help out, and it was truly an experience for us.
So now that we're done with the class, we were, I think, the first graduates of the Enhanced Learning Environment classroom. Dun, dun, dun. And it differed a lot. I've been an online student in the past. This class offered so much more because we were able to have 24-hour access to the classroom. So some of us who have weird sleeping habits, as graduate students do, we were able to go to the computer and figure out who was on, what we needed to read, and how many people were trying to discuss different issues. We were also able to, just like the telepresence was an awesome experience, one that we would have never been able to have without Cisco and Paula and everybody working together. As well as James being able, he was so wonderful. He would videotape us as we were doing our presentations. Who doesn't want to be videotaped while they're doing a presentation? And to put that on the web so that we were able to access it later on when we needed it. I think that's it. So thank you.